Good day and welcome to Westchester Talk Radio, westchestertalkradio.com. I'm John Marino and we are produced by Sharc Creative, made possible by Robeson Oil, the house that service built, by Lipolis Electric. Don't be left in the dark. Get Lipolis. By Hightower Westchester, managing your wealth to a fiduciary standard, by White Plains Hospital, and by Michael Labriola, landscape design and construction of Armonk, plus Tompkins Mahopac Bank. This is what's happening in the Lower Hudson Valley. We are joined by the Westchester County Commissioner of the Department of Health, Dr. Sherlita Amler. Dr. Amler, welcome back. Let's talk COVID. Obviously, the COVID numbers around the county right now, do they seem to be going up, down, stabilizing? What direction do we seem to be headed in at this moment?
Well, right now, our numbers seem to be stable. We did see an uptick around July. And for a while, we were seeing about 200 cases a day. It's trended down to somewhere around 175, 176 cases a day. And we're hanging out pretty much there since July. So our case counts have been stable.
How about vaccinations, vaccination rates around the county with all the work that's been done to get people vaccinated? Has this worked? Has the effort worked?
Well, I mean, in Westchester, we have some really good vaccination rates, some of the best vaccination rates in the state. We have somewhere around 648,000 people in the county that have completed vaccine series. They have both their shots or one shot of Johnson & Johnson. That's about 65% of our population. We have about 75% with at least one dose. I think that's probably as good as any other county and better than most in the state.
Does it matter which vaccine you get, or is there a way you should go about selecting which vaccine you should get? Pfizer, Moderna, Johnson?
Well, the advantage to Johnson & Johnson is it's a single dose. So if you have somebody who is homebound, has difficulty with transportation, that is sometimes a really good option. And in fact, we send nurses into people's homes who can't get out for medical reasons or whatever the reason is, they just are homebound. And so for us, that's a really great shot to use because we only have to go in there one time and we don't have to worry about scheduling a second dose or them trying to get into their doctor or somebody else to get a second dose. But other than that, it really just is the personal preference of the individual. A lot of people like to read about the various vaccines and they have strong opinions one way or the other. Some of the news coming out seems to say that Moderna is doing slightly better than Pfizer as far as antibody count more than 6 months after the second dose. But, both vaccines have a very good track record and they're still both very effective, even 6 to 8 months out. So we're very pleased with, how these vaccines have performed.
Moving the direction of possibly getting booster shots, is this something that, according to the information you've gathered, that it's something we will need to do? And we've seen a lot go on with that the past few days on the federal level.
Well, the FDA, which authorizes vaccines, and the ACIP, which is a committee that is associated with the CDC, have both been reviewing this over the last 2 weeks. And the FDA just came down to say that their recommendation is for boosters for people who are over 65 or who work in jobs where it places them at high risk of contracting the disease and transmitting it to others. The ACIP is still meeting. They met yesterday. They're meeting again today. And so it waits to be seen what their recommendation will be around. Some of the questions that are being asked are, if you got Pfizer, does your booster have to be Pfizer? They're also looking at children, young children less than 12 have not been eligible yet to be vaccinated. So these various groups are looking to present us with their recommendations around should should we go ahead? Is it safe to go ahead and vaccinate children who are less than 12? It's looking like they're going to say yes. And we're kind of expecting that we may get that authorization to be able to do that in the next month. And that would be great because currently we can't protect our youngest children from COVID.
Mm-hmm. We also have the question about the unvaccinated and how infected they are, the unvaccinated, with numbers going up, going down, moving around. Unvaccinated around Westchester County, do they account for most of new cases that come in?
They do. They account for more than 2/3 of all the cases that come in. Now, we always have to think about as we get more and more people vaccinated. Of course, then the vast majority of our population, as I just told you, is vaccinated. And of course, there's always the possibility of breakthrough cases. But the vast majority of people who get COVID are still unvaccinated. And unfortunately, the vast majority of people who end up hospitalized and who die are unvaccinated. And so that's the real, no one says that the vaccine is going to prevent every single case of COVID. And we know it won't. But what we are seeing is that it prevents most of the people who are vaccinated don't end up hospitalized and they don't end up dying. And so that's very similar to what we see with influenza. And so, if you're going to tell me that I could still get mildly ill, but I'm not going to be hospitalized or die, I'm going to take that chance because I don't want either of those two outcomes.
Is that the best thing you could say to somebody who is reluctant to get vaccinated, that just look at the numbers locally around the state, the country, and worldwide? And if you're into numbers, you don't have to work with them too much to see that the numbers are in favor of if you're not vaccinated and you get sick. Well, chances are the outcome may not be the kind of outcome that you want, and we don't want to have to be going to your funeral. I hate to put it that way, but that's what happens sometimes.
That's exactly right. And so, the safest thing to do, and that's why we're so, excited about the fact that hopefully very shortly we will be able to vaccinate children, because we are seeing more and more cases of children who are getting COVID. And that only makes sense because they aren't vaccinated. So right now, if you're, under the age of 17, you are about 21% of the COVID cases we get are in kids. And so a lot of people used to say to me, oh, well, children don't get sick, they don't get COVID. But that's not true. They absolutely do. Mm-hmm. They just don't have the same hospitalization rates and the same death rates, but they can certainly get COVID and they can get sick and they can end up in the hospital and they can't even die. We have had at least one child that I know of that died in Westchester. So, it can happen.
And they can pass it along to someone else too.
Well, that happens all the time. And, so I'm always hearing stories about, someone went to a wedding or they went to a party or something, and then they went to visit their grandmother or some other elderly person. And even though they didn't feel that sick and didn't think they had COVID, they unfortunately infected an elderly loved one. And a lot of times those elderly loved ones just don't do very well with COVID. They may have a much greater risk of ending up in the hospital and dying. And so, you just hate to hear those stories, and it's just very sad.
Where can you go around Westchester, the key locations to get vaccinated? Besides, of course, I know you do run some pop-up vaccination sites from time to time, too.
Yeah, and actually, I just read in the paper that the state is about to do 120 pop-up sites around the state, primarily, I think, aimed at children. But in Westchester County, we have clinics every Friday at our White Plains Clinic, which is very close to the county executive's office and right near social services. And we have clinics there from 10 o'clock in the morning until 1 in the afternoon. You don't have to have an appointment. You can just come in and get a COVID vaccine. And in fact, we also offer school immunizations for children and immunizations for adults, other immunizations for adults who do not have health insurance that will cover it. And so that's available at our White Plains office. And also at 20 South Broadway in Yonkers, we have a clinic there that we give vaccines. I believe it is Monday evenings from 4 to 7 and Thursdays from 4 to 7, Thursday evenings from 4 to 7. You can look on our website and it'll give you the exact address and the time and the location. Beyond the health department, we still have the county center, which is in White Plains, and they give vaccines on a regular basis. A lot of people still go there. And local pharmacies, a lot of our local pharmacies give vaccines. A lot of physicians' offices are now providing vaccines. And then there's all kinds of pop-up events that occur at various churches and events. Then we're still doing home immunizations for people that are homebound. So there's many, many, many places and ways for people to get vaccinated. If you want a vaccine, there's really no excuse. I mean, it's easy to get. And in fact, now the county center and we are providing third doses. And some people don't understand what the difference is between a booster and a third dose. So a third dose, which is totally authorized now, is for people who have cancer or HIV or some underlying medical condition that impacts their body's ability to make antibodies. So their immune system is not competent. And so they've had 2 doses of COVID vaccine, but because of medical conditions, they may not be fully vaccinated. And so in that instance, they've already, the federal government, state government has already authorized these people, no matter what their age, as long as they're over 12, to receive a third dose of COVID vaccine. That we can do now. We are still waiting on the ability to provide boosters. So a booster is not the same as a third dose. A booster is a third dose, but it is a dose of the COVID vaccine to somebody who is already fully immunized, meaning they've had 2 doses of Moderna or Pfizer, and they are immunologically competent. So they are fully vaccinated, but the immunity may be waning because of time. So it's looking like they're going to say at least 6 months since your second dose, and it could be 8 months, and we're waiting to see what the FDA is going to say about that. And again, that looks like that is going to be primarily for individuals 65 and older.
I'm about to be 65 in 2 months. Does that mean I could just at that point walk in, get my third shot or get my booster at that point? Or do I need to be displaying or be able to prove some kind of underlying health condition that indicates that I do need this? And if, hey, John, if you're okay and you're 65, let's save that dose for somebody who needs it.
So if you did have an underlying medical condition that impacted your immune system, and you've had 2 doses, you could go now. Because they're not requiring you to wait 6 to 8 months afterwards. I believe the minimum time is 2 months. But if your immune system is competent, then we're going to have to wait for the FDA to tell us at what point we can start giving the boosters. But yes, it's looking like you would need to be 65 years of age. And so I don't have all the details on that because they haven't finalized it. Probably that will come out sometime next week, and we'll probably be hearing, when and where and how we're going to be able to do that. It is quite confusing, and so I understand people's, just not quite understanding and getting it. But again, third doses are for people who have some medical condition that their immune system is not making antibodies properly, and boosters are for us who have competent immune systems. But we have had a waning of our immunity because it's been a while since we had our second dose.
Dr. Sherlita Amler is the Commissioner of Health here in Westchester Talk Radio. What's happening in the Lower Hudson Valley? I'm John Marino. Dr. Amler, the new Mu variant. What are the early returns on that? How prevalent is it? How dangerous might it be?
So right now, the 90% of the COVID cases in the United States are the Delta variant. And so there's constantly variations. And so far, I'm not seeing anything that says that it's going to be any worse than Delta. But the virus, the COVID virus, is constantly mutating. So every time it infects a human being, we have the opportunity for that virus to mutate and to do things that it didn't do before. And so what do we worry about? We worry that new mutations might be able to be resistant to the vaccines that we are giving. And the variant that has shown most resistance was, I think, the beta, but that's not been a very prevalent variant. So, but that is our concern. The concern is that we get a variant that the vaccines don't work on. And, but the thing about the Delta variant that has everybody talking about Delta is that it's twice as infectious as the previous variations of this virus. And that's because when a person becomes infected with the Delta variant, their cells make a lot more of the virus. Because remember, viruses can't replicate themselves. How they grow is they invade a human body, they get into our cells, and they turn our own cells into little factories. And our own cells make the virus that then can kill us. So if our own cells are infected with these, with some of the new viruses, the not viral strains, then, as in this particular case with Delta, it causes our cells to make twice as much viral particles. And that means that it stands a chance of overcoming the amount of antibodies that we have in our body. And how that works is that the antibody binds at the receptor site, the spike protein, and prevents the virus from getting into another cell and turning that cell into a little factory. I know this can be very confusing, but the reality is that every unvaccinated person stands the chance of having a mutation that could really be bad. So that's one of the reasons we want everyone vaccinated. So there's less COVID infections and less chance of variants occurring.
Do we need to cut to the chase and just issue a county-wide vaccine mandate?
Well, I think here in Westchester, we have done an excellent job. I'm so proud of our residents because they really have taken this very seriously. And, you know, when we say that we have 65% of our population completely vaccinated and 75% with one dose, you know, I would love to say that we had 80% fully vaccinated, and I hope we will get there. But I'm very proud of how well we have done in Westchester. And I commend our residents for listening to their doctor, listening to the public health officials, listening to people that they trust, and not listening to a lot of the misinformation that's out there, and getting vaccinated.
How about kids in school? Do they need to mask up? Do we need to have kids walking around in masks, or do we need to continue this? And I think it's a very effective way of learning, the remote form of learning, or some kind of combination based upon what school districts, what parents, what teachers want, et cetera. It can't be cookie cutter now. I think we've learned that over the last couple of years.
Well, there's very strong public sentiment, both sides of these stories. Should children be vaccinated or not? Should they go to school? Should they not? Should they wear a mask? Should they not? You know, my thought on this is I want to do whatever is going to make our children the most safe. And I know that 21% of our current new COVID cases are in kids. And when I look at who are they exposing it to, who are they, when they get infected, who are they exposing? And when I look at that, the contacts are primarily in their home and at school, because that's where kids go. So the chances are, if they get COVID, they can expose other people in their school, in their classroom setting. So how can you prevent an exposure when you have cases in school? There's not that many things you can do. One, you can social distance, but it's impossible to social distance to 6 foot from every student and bring every student back into school. Their schools just aren't that big. It just is impossible. So the most we can do in schools is about 3 feet. And so, so if you can't fully social distance, the next best thing you can do is mask everybody, because we know that masks do help prevent the spread of COVID. It really does. It's not 100%, but it really does help. And so, I'm all for masking. I mean, when I'm out and about, I wear a mask. I don't ask people to do things that I don't do myself, but the real answer, the real solution to all of this is vaccines. And unfortunately, I can't vaccinate you if you're less than 12. But, if you look, the older children are getting vaccinated. And so that is the best way. Get the teachers, the staff, everybody who works at a school, the students that we can get vaccinated, and hope that as soon as we can vaccinate those 12 and under, that their parents will take them to someone they trust, whether it's a pediatrician, their health department, a pharmacy that they've used for years. It doesn't matter. Just take them in and get them vaccinated. And we really hope that we're going to have that ability in the next month or so.
I know I can't take a vaccine and walk up to a couple of people I know who, until today, still are refusing to get vaccinated, stick it in their arm and tell them I'll do it again to you in another 3 or 4 weeks. But here we are almost 2 years into this pandemic now. How do we finally put COVID behind us?
Well, if you think about what it was like last year, you couldn't go into a restaurant. Restaurants were closed. There was no plays and on Broadway. There was no music. There were no weddings. There were no events at all. And so with vaccines, we have been able to open our society a great deal. People are now getting married. People are going into Broadway to see a play. They are able to go to a restaurant and have a meal. And so a lot of our world has normalized, and that is because we have vaccines. So I am hopeful that once we get the pediatric population vaccinated, that things will continue to improve, and that by this time next year, and I hope even before then, this is going to we're just going to be saying, remember what was going on when we had COVID, and thank God, we don't have that problem now. We'll have to wait and see. So in a year, you and I will have to talk about it and see where we are with it. But I'm hoping that we're in a different place altogether this time next year.
I hope 1 year from now, we're talking about something else, just health issues in general, and not having to focus on COVID still by that point. Much sooner than that, like you say.
That would be lovely. It really
That would be great. Dr. Sherlita Amler, the Commissioner of Health here in Westchester, we thank you, as always, for joining us on Westchester Talk Radio. What's happening in the Lower Hudson Valley? I'm John Marino. We are produced by Sharc Creative, made possible by Robeson Oil, the house that service built by Lipolis Electric. Don't be left in the dark. Get Lipolis by Hightower Westchester. Managing your health to a fiduciary standard by Michael Labriola. Landscape design and construction of our month by White Plains Hospital and by Tompkins Mahopac Bank. Catch all of our Westchester, Rockland, Putnam and Dutchess, Orange, and Fairfield County talk radio programming on our YouTube channel, Sharc Creative YouTube, and we have an app now for Westchester Talk Radio. Download it, take it with you anywhere and everywhere you go. It's called Westchester